Welcome back. As the state continues to open up with restrictions in place, Mississippi has not seen a decline in coronavirus cases. I spoke with cardiologist Dr. Faluso Fakaridi about his opinion on this.
Pandemic pretty much earlier in March, and now kind of speaking to you, I'm not going to say it's the end of the pandemic, but things are starting to open up a little bit more. What is your opinion on it? How have you personally been throughout this, and you've been seeing it firsthand?
Right. Um, Quite honestly, it's mixed feelings. You do want to get back to normalcy, but I think until we get either a cure or until we get a vaccine that's been studied in a large randomized trial, we still need to practice precautionary measures, and I think we have to ease into it. I think there are a lot of states, especially in the South, who are rushing to open up the markets and get people back in. What you have to understand is that, patients who are predominantly in these areas have chronic conditions. And so we need to not only protect them, but we also have to have policies that reflect that protective measure. From our standpoint, we're still screening patients and telling patients who can stay home to stay home, wash their hands, wear a mask, and hand washing techniques. Education and health literacy is a very important component to this, because what I call functional literacy, the ability to be able to go and read the CDC guidelines, a lot of folks that we see in our communities cannot do so. So what we do is that we have like signs and telling people, how to practice, hand washing techniques, how to practice social distancing, staying 6 feet apart. The diagrams and the visuals actually work more with these patients. In terms of, trying to get them back into the gyms and to exercise, that's something that as a society, I want them to be able to do. But we have to do that with definitely definitive restrictions. And we also need to make sure that availability of providers is something that we need to discuss, especially testing. We have not done a great job having testing availability for all of our community whenever they want it. For instance, if you and I wanted to go vote, there's a polling site that we can go to vote. Well, the same should apply for testing. If you and I had symptoms today, we should just be able to pick up a phone and go get tested and not scramble to go to another city or go to another site to get tested. And so testing and contact tracing is something that we have to provide and infuse more resources so that we're able to, be on the mitigation end of things and not doing this all over again. And having to expose frontline workers such as the great nurses and doctors and respiratory therapists and other people who are out there trying to save lives in the hospitals.
I do want to ask you another question before we wrap up, but do you think opening the state is potentially prolonging this? Do you see it getting worse? People are talking about a second heat in the fall. Do you see it getting worse in the fall and the winter? What is your opinion on this?
If we do not believe in the science, and if we have people who are what I call cognitive dissonance, meaning that their attitudes and behaviors, and in terms of not only their thinking, but also in terms of their what they do, is not incongruent with what the guidelines recommend. For instance, if you have young people throwing parties, or you have people going out early on and not wearing masks or washing their hands, and people not practicing social distancing, what happens is that we will definitely see another rebound. That is a promise. The virus has not gone away. The virus is still around. And so we have that responsibility, and our moral consciousness has to make sure that we actually follow those guidelines, not only to protect ourselves, but to protect our parents, our grandparents, who lack that immune response or protective mechanism that we younger folks might have. And also, we need to protect those with pre-existing conditions. We carry majority of that burden here in these southern states and here in the Mississippi Delta. So in terms of opening up the state, we have to use guidelines that actually parallel the population that we have, that we consider at risk. And then we have to take those slow steps to re-engage everyone. And we have to do that in a wise way, both so that we can have good clinical, economical, and human outcomes and not have to deal with more fatalities.